It's a call no parent wants to receive. Gosingphile Tabedze was at work when he received the news that his 14-year-old son, Khosi, had been bitten by a snake.
I got there to find him in bad shape. At the time, we had no idea that he could have been bitten by a black mamba. On the way, the road was bad. I could see the very life from my son slipping away. I couldn't help but break down.
His son was saved thanks to the availability of Antivenom for the bite. But if it hadn't been for the Luke Commission, a faith-based healthcare provider, things might have turned out differently. Each vial costs as much as $120 US, a price Tabedze could never afford. Eswatini sees about 200 to 400 venomous snake bites a year, according to the Eswatini Antivenom Foundation. There are 8 species of potentially deadly venomous snakes in this country. Species like the puff adder, Mozambique spitting cobra, and the much-feared black mamba are responsible for most of the serious snakebite cases. According to the World Health Organization, antivenom is the treatment for snake bites, but there is a worldwide shortage because it is expensive and difficult to produce. And that's where the Luke Commission comes in, says Echo Vanderval, co-founder of the group that brings free health care to Eswatini's rural population.
In the past year, we've admitted over 250 snakebite patients, and we've not had one person die or one loss of limb in the last year. So we're so grateful for that.
The Eswatini Antivenom Foundation can be inundated with up to 400 calls during the snakebite season, the hot months of August and September. The victims are transported, admitted for observation, and treated with antivenom if necessary, says founder Tia Lechka Kuhn.
There's a significant shortage. There has been for about 3 years now that we have been fighting to try and save lives with as little as 100 vials of antivenom per season.
Zakele Hlope is a volunteer at the Eswatini Antivenom Foundation.
The people who are out there in the communities, some of them, they are not well versed about snakes. They kill the snakes, and they still have traditional beliefs that when you are bitten by a snake, you need to have something to drink, a concoction, or you have to have a certain powder, which also contributes to the increase of the number of deaths due to snake bite.
Government officials in Eswatini say at least 6 people have died of snake bites so far this year, and 80 to 100,000 die worldwide each year, according to the World Health Organization. Healthcare experts say lives will continue to be lost if governments don't address the antivenom shortage. Nokukhanya Musi, VOA News, Manzini, Eswatini.